So welcome. Thank you, Kristen, who's running in the background, all of our prep for this webinar. So this is Accessibility 101, How to Write Alt Text and Map Participant Journeys. I'm just going to let you know that I'm running this, the slides right now in this view instead of presenter view. I have a little trouble seeing the arrows in presenter view that are clear. So just for visibility, it's a little easier for me to run the show this way, but please write in the chat if it's difficult for you to see. So I wanted to introduce myself. I'm Dr. Willianne 𝐑𝐄𝐀𝐂𝐇. I am a program director at the Multi-Regional Clinical Trials Center, and I lead our efforts in diversity, equity, and inclusion. And I'm here today with Skye Peral, who is an IRB analyst at USC. And I'll let you introduce yourself, Skye.
Thank you, Lillian. I'm really happy to be here and provide some knowledge to help people learn how to go through alt text. I've been with my IRB for about 3 years now, and I have previous experience with teaching blind students, and so that's where I come in.
Thanks so much, Skye. And I should also mention, I have the banner behind me, but Happy Disability Pride Month. I'm a person with a disability, and I believe, Skye, you are as well. If you, so we know the journey, and also just wanted to say that we have a few housekeeping notes. And beyond that, just as a physical description of myself, which I should have given, I have long brown hair and white skin, and I'm wearing glasses today, and I have a pink shirt on. Skye, do you want to introduce yourself as well?
Sure. I have long, dark, almost black hair. I have light skin, blue eyes, and I'm wearing a shirt with a pattern on it.
Thanks so much. So just a couple of small housekeeping notes. One of them is that closed captioning is enabled. So if you would like to view the closed captions, just click on the little CC button that should be kind of along with your Q&A and the chat and things like that. Please make sure to keep the captions in English. We have some kind of funky setting going on where if you change the language, it changes it for everybody. So just keep the language in English if you can for closed captions. And then the last thing just about the chat and the Q&A. So this is we're going to try to make this an interactive webinar to the greatest extent that we can. It's summer, so we're trying out a little bit of a different format and we'll see how it goes. But for the chat, what we're going to do is if you have kind of comments, that are general comments to the group, or during the exercises, when we're filling out the exercises, you can use the chat box. For the Q&A, we're going to have about 10 minutes of Q&A at the end of the session. If you have a question that you want to discuss with the panelists during the Q&A, please put that in the Q&A box. That way we'll know which questions to answer. And also Kristen can kind of find you in the list if you want to be promoted to speak as well during that session. So chat largely for the exercises and kind of overall general comments. Q&A is for specific questions for the end of the session. Okay, so I'm going to go on. This is our standard disclaimer that the material and opinions expressed here are our own. They're not intended to represent our institutions. The MRCT Center is supported by voluntary contributions, and we have a Creative Commons license. I also wanted to mention that this webinar is being hosted by the REACH project, and the REACH project is a Research Ethics Action Collaborative for HRPPs, and it's a collaborative between the MRCT Center, Mass General Brigham, AHRP, which is the Association for the Accreditation of Human Research Protection Programs, and PRIMER, which is Public Responsibility in Medicine and Research. So this collaborative has gotten together to kind of work for DE&I kind of collaborative efforts across IRBs and HRPPs. And for those of you who haven't met the MRCT Center before, just to give you a little bit of a background, we are a collaborative center between the Brigham and Women's Hospital and Harvard. And our vision is to improve the integrity, safety, and rigor of global clinical trials. And we do that by collaborating across all clinical research stakeholders to basically develop find out what the main issues are across clinical research and to try and develop tools and best practices that can be utilized by different stakeholders. So before we get into the exercises that we're going to do, I'm going to give you a little bit of background on disability. So to start with some disability data, there's over 1 billion people in the world and 240 million children globally that live with a disability. People with disabilities are the largest minority group in the United States. 1 in 4 US adults have a disability, and that proportion is higher in minority communities. So for example, 1 in 3 Black and Hispanic adults have a disability. And there's different kinds of disabilities, such as visual, hearing, mobility, chronic conditions, like I have severe asthma, so you might hear my voice get a little shaky, mental health, cognitive and intellectual disabilities. And I just want to note that mental health and cognitive and intellectual disabilities are not the same thing. So to talk a little bit about ableism. So ableism is defined, I put on the slide, one definition is that ableism is a network of beliefs, processes, or practices that produces a particular kind of self or body that is projected as the perfect, as the ideal standard. And then disability is cast as a diminished state of being human. So we're going to kind of keep talking a little bit about ableism as we go through these slides. So I wanted to talk a little bit about ableism in clinical care. So we see ableism kind of rearing itself in clinical care, where clinicians report, and a large majority of them report, that they assume that people with disability have a worse quality of life. And they also report that they don't feel comfortable treating patients with disabilities. They report saying, "I'm not the doctor for you." And this is some of the work that was done by Lisa Iazzoni and others that's been recently published. And we will be posting these links afterwards for people to be able to see. In terms of becoming a clinical provider, the proportion of providers who are people with disabilities is low. Only 3% of surveyed physicians self-identify as having a disability, and only 9% of that 3% identify as members of underrepresented racial groups. So you can see that in these surveys, very few people who are providers are people with disabilities. So very few people have that lived experience when they're actually providing clinical care. And there is a great new initiative, well, I wouldn't say new, but recent initiative called Docs with Disabilities. It's led by Lisa Meeks, and they have wonderful tools, and they're doing a lot of advocacy and data collection around the prevalence of people with disabilities who work in medical care. So then shifting a little bit to clinical research. So this builds on, so many clinical research come from the medical field or either providers in some way. So this is some data that's showing that NIH grant applicants who reported having a disability actually declined from almost 2% in 2008 to about 1% in 2018. So we're down to about 1% of people who are getting NIH awards who have a disability. And if you think about it, 1 in 4 in the US adults are people with disabilities, but only 1% are people who are clinical researchers. So there's probably a strong component of ableism that's kind of threading its way through there. Just to mention a little bit about how we think about this in terms of equality and justice. So I love this slide that we didn't create, but I put it up a lot because on the left-hand side, you see kind of a graphic of equality where we say that equality is where everyone gets the same support. And what's shown on the screen is that there's 3 people. They're trying to look over a fence to see a soccer game. One of them on the left is tall, one is kind of a child, and one is a person who uses a wheelchair. And they're all given the same box. And really only the person who's tall can see over with the box, and the child can like somewhat see. But then in equity is where everyone gets the support that they need. And in this case, the child has 2 boxes, and the person using a wheelchair has a ramp, and everyone is able to see the soccer game. So I wanted to move a little bit into disability laws. I'm just going to put this on the screen so that people have it for later. There's many different laws and guidance that is applicable to disability rights. So there's the International Convention on the Rights of the Person with Disabilities, which the US has not signed, but most countries have. There's also the Americans with Disabilities Act, Section 504 of the Rehabilitation Act, and this was recently updated. So I advocate for everyone to look at the most recent version of the 504. MRCT did do a response to this, which kind of goes over some of our key thoughts around the proposed rule. Section 1557 of the Affordable Care Act was also recently updated. And kind of the key takeaway from these is that they prohibit discrimination against people with disabilities in the healthcare field and in clinical research. So it's not only, a nice thing to do, or, it's the law, and it's something that people need to follow within their companies. So just going on one more slide on disability laws, just to say that state laws can vary kind of widely in terms of coverage for disability and things like supported decision-making. There's also specific clinical research guidelines. So under Health and Human Services, under the FDA, under NIH, there's different guidelines which are listed here. Some of them include protection of human subjects, 45 CFR 46. Under the FDA, diversity action plans are now required for phase 3 and later trials. And although they focus on race and ethnicity, they also mention disability. And as I said before, 1 in 3 people from Black and Hispanic populations have a disability. So you won't really be able to reach your minority populations unless you make your trials accessible. For the NIH, people with disabilities were recently declared to be a population with health disparities. And for the Health and Human Services, there's a Secretary's Advisory Committee on Human Research Protections called SACHRP. So just a couple more things to go through. The MRCT Center published last year a guidance document called Accessibility by Design, and this is a toolkit. And I have the screenshot on the slide, and I think Kaya is putting in the chat the link to that. And the toolkit goes through 5 sections. So we have general considerations, communication accessibility, physical accessibility, and then things like newer strategies for inclusion and accountability and advocacy. So the accountability and advocacy is things you can use to advocate, for accessibility within your organization. And the toolkit is broken into 2 sections within each of those. We have key points and we have specific tools. So the key points are broken down into green circle for easy, blue square for moderate, and black diamond for advanced. And many of the key takeaway here is that many of these things are actually easy. They're green circle, they're blue square, they're low cost. So things like, talking directly to the person with a disability, giving extra time for people to consider what you're saying and to respond, using large size font and contrasting colors, refraining from animation in your, so these are all just very easy things to do. We also have specific tools on clinical research. In this one, we talk about eligibility criteria. So this one, we had done a study, which is on the next slide, that showed that people with disabilities are often excluded from trials due to eligibility criteria, which right now the problem is that they're very, very broad. So they can say something like subject has any condition that confounds the ability to interpret data from the study. So then what happens is they can, someone who's screening people can say, oh, well, I think that person with a disability might confound the data. So we always advocate that all eligibility criteria need to be specific and justified based on safety reasons. And so we give examples of problematic and preferred eligibility criteria. And this slide just notes the study that we did that showed that only 24% of the exclusions that we saw listed that excluded with people with disabilities had any kind of justification listed. And many of those justifications were very broad. So I just wanted to say a couple of areas of current discussion that are not in the toolkit, but are really kind of at the forefront. One of them is around capacity assessment for people who have intellectual and developmental disabilities, or who have some kind of cognitive disability. So there are some tools out there, and these are listed on the slide. One is the Include Impaired Capacity to Consent framework that's out of the UK. And then there's a new toolkit also called Participation. It's called, Accessible Research Ethics Education for All. And this is to involve people with cognitive and intellectual disabilities as researchers. And it's a great new tool. And then just to say, there's a few other areas of discussion that are really coming out, and one of them is around decentralized trials. So during COVID, there was a huge push for decentralized trials, which is great, bring trials closer to people. But are these components accessible? If you have all these different mobile applications, are they accessible? Are the units, the mobile units, physically accessible? And are they financially accessible for people with disabilities? And lastly, just to say, we're still trying to sort out data collection, define standards for data collection. Currently, there's no data collection in clinical trials around who has a disability and who doesn't have a disability. And so we're trying to work on that, because what you don't measure, you don't know. And also trying to understand financial impacts in participation in clinical trials. So for example, if you have, are you getting reimbursed for participation in clinical trials, or are you getting compensated? How does that impact your tax liability and any benefits, public benefits you may be receiving, such as, food assistance or housing assistance? So those are just a few kind of summarizing disability kind of overall in general. We're going to move now into the exercises, and we're going to start with an alt text exercise. And I'm going to turn it over to Skye to start with describing alt text.
Thank you so much.
Yeah.
So alt text or alternative text is written statements to describe an image or a graphic for a person who's not able to see it. Alt text can be read by screen readers. Screen readers are assistive technologies that are either software or hardware that read information about images, menus, dialog boxes, and files. And then it conveys that information either through audio or a braille format for the person using the screen reader. Alt text can be used for icons, pictures, graphics, sometimes charts, depending on the complexity of the chart. And in Word documents, PowerPoint, which we'll give an example later of how to do alt text in PowerPoint coming up, social media, websites, apps, and any other participant-facing media. Alt text can be displayed by websites if the images don't load properly. So a little bit more background information is that alt text should convey the meaning of an image as it relates to the context or content. So here we have an image of the scales of justice. An example of alt text that we would not want to use is a picture of a scale. And alt text that we would want to use is a scale representing justice that is equally balanced. And so the difference is that we can see that there is more of a direction with the alt text that we are trying to convey with the image. For decorative objects, you can just write null in the alt text box in PowerPoint or select mark as decorative when you get to that alt text screen that we'll show you in a minute. Don't use any emojis or any personal opinions such as a disheveled patient within the alt text box as a description. You should be able to clearly and concretely describe the image through alt text, and you don't want to use any images that require any sort of abstract thinking. So here for step one, as our example in PowerPoint, these instructions may differ a little bit for Mac computers, but for a PC, you want to right click with the rightmost button on your mouse and click on any photo, chart, or image, and then select View Alt Text from the drop-down list. Alternatively, you can go to the Review tab within the ribbon, and then go to Check Accessibility, and from there select Alt Text from the drop-down list. And there are built-in features for Microsoft programs such as Word and PowerPoint that can support accessibility features in more ways than just alternative text. Also, these features that are built into PowerPoint, when you do convert to a PDF, they do translate the accessibility features into that new PDF document as well. So for step 2, you're going to using either method, a box will appear on the right-hand side of the screen, and this is where you're going to enter your brief description of what the image shows. So we're going to go through our exercise here. We're going to review each image, and there's going to be 5 images together. When prompted, you can enter your proposed alt text into the chat. There's going to be extra additional content for images 2 through 5 provided, so you may better convey the meaning for each image. At the end of the exercise, we're going to go ahead and summarize what we learned together.
Thanks so much, Guy. So I'm going to kind of moderate our exercise together, and we're going to kind of take some pauses, and Sky's going to monitor the chat and kind of pull out key lessons learned as we go through. So let's just start, and we're going to see how this goes. So on the first image, so you see here on this first image here with the patient or participant and the physician, what I want you to do is look closely at the image, and then in the chat, I want you to try and draft 1 to 2 sentences of alt text. Not everyone has to do it, but I'm going to give you about 30 seconds to try and just look at the image and think about what you would initially write in for alt text. Okay, Sky, do you want to pull 1 or 2 of those out just quickly? And then I'll go on to the next slide.
Yeah, so we're seeing a doctor speaking to a patient sitting on the examination bed. We're seeing a patient sitting on an exam table, looking at a physician who is speaking directly to the patient, a little bit more specific. There's a lot of options. A young Black patient is sitting on an examination table in a medical office being interviewed by a Black female doctor.
Great, so there's a lot, you can tell there's a lot of possible options here. So I'm going to go on to the next one. So take another look at this image. It is the same image from before, but we've added some context. So in this image, you are discussing the accessibility of the medical equipment, such as the exam table. So here you have some specific context. Say you're doing a presentation on disability and you're trying to discuss the accessibility of the medical equipment. Again, I'm going to give about 30 seconds, 45 seconds for people to write some alt text in the chat. Sky, anything jumping out at you?
Not quite yet, they're coming in still. We have one, a Black female patient seated on a height adjustable exam table speaking with a Black female physician. We have another one with a patient sat on a non-adjustable examination table with her feet not reaching the floor talking to a doctor.
Great. So I just wanted to point out there, I think people are starting to put this in the chat, is that they're noticing specifically the table, which I thought might not be adjustable, but trying to comment on, is it accessible for the participants there? And you're right that their feet do not reach the ground. So this may be difficult for a person to get up onto the table if it's not adjustable. So it's exactly what we were trying to get to in this type of image. So I'm going to go on to the next one. So in image 3, I want you to look again at the same image. And some people, I think, were starting to pick up on this in the previous chat. But in this one, let's assume that the context is that you're discussing the importance of workforce diversity. So workforce diversity in a clinical care or clinical research setting. Why don't we let another about 30, 45 seconds for the chat to run. So I'm just going to comment on the chat. I'm seeing people remark that there's an African American or a Black physician who is in conversation with an African American or Black or potentially Hispanic participant. So this is what we're trying to get to in terms of describing people within the context. And it's been an interesting discussion as we've had this discussion amongst ourselves and as we've done these trainings kind of in more smaller contexts. Some of the respondents have noted in these trainings that they've been really uncomfortable with describing people physically, whether by racial, characteristics or by clothes or hairstyle. However, in the disability community, we often do describe ourselves with physical characteristics, particularly when we're working with people who have low vision. So it is something that is kind of a line to discuss with the community that you're working with, in terms of developing your presentation. But physical characteristics are something that we do tend to talk about kind of a bit more just in general. So I'm going to move on to the next slide. And thank you so much for all of the great work within the chat. So we're going to go on to these next 2 slides. I think for the purposes of time, I'm just going to explain these and then we're going to go on to the lessons learned. So I just want everyone to look at this chart, which is showing, it's a chart showing employment of disabled Hispanic workers age 16 plus by sector. It's a pie chart, which shows most of the pie chart is in blue for profit sectors, about 600,000. And then there's several pie pieces for nonprofit, self-employed, and public. And so we were going to ask you, how would you describe this in a alt text setting? So one of the challenges here with charts is that generally in alt text, you don't want to go beyond like maybe 3 sentences because it gets very complicated for the person to read. So if you're using a chart, you need to use something that's fairly simple without too many, for example, pie pieces or different kinds of layers, different kinds of information in the chart. And when you go to describe it, you need to be clear about the type of chart that's being presented. So, is it a pie chart, a bar chart? And then what specifically the data points are. So that can be pretty helpful to say something like the for-profit sector is 600,000 and takes up more than, half of the chart. So things like that. And you can say it is shown in blue, whereas nonprofit is shown in green. And then just the last one, we were going to throw you a little puzzler, a little bit of a loop, but we wanted to show this one because we see a lot of these now, particularly when you're talking about data or we have a new project at the MRCT Center on cell and gene therapy that has some interesting images. And when you get an image like this, we wanted to ask you, just think in your head for a second, how would you describe that for someone? It's very complicated. And if you have to describe it in something like 3 or 4 sentences and go into a whole paragraph on what this is, it may not be actually a helpful image to use to complement what you're trying to convey. So just to give a little bit of a background there. So, and I just wanted to show you very quickly myself, since I have screen privileges. If I right click on this picture right now, you can see the box lights up with these kind of circles around it. And I can scroll right down to view alt text. And you can see right now that it's blank. Sometimes there's default text in there, but I can type in something like, this is a picture of, yeah, and then I get confused. It's such an abstract picture. So a picture of data, data lines or something. So it's just to make the point that it's, a little bit confusing on some kind of image like this. So I wanted to go on just to point out some of our lessons learned. And Sky, I thought you could help me with this, pulling these out, things that you've seen in the chat. So are any key things that you've seen in the chat right now?
Let's see. Maybe give me one more minute.
I'm going to start with context is very important. So we saw that the context, really changes how you're going to describe the image.
I think we're learning that it's also hard to get the right information in as few words as possible that's impactful.
So that's another great point, that this does take some thought. It's not something that you can just kind of do very quickly as an afterthought. Really be thoughtful about this in your presentations and kind of preparing for your presentations. I'm going to put in that describing physical features may be appropriate depending on context. Anything else, Sky?
Nothing's particularly jumping out at me. Is there something else? I know there's a couple of other things we wanted to highlight as well.
Okay, we can move on to the next exercise. I think we'll go on to the next one, which is physical accessibility. And I'll have you talk about this just from the beginning.
Yeah. So here we're talking about site accessibility for your clinical trial sites. So we want to pay attention to the physical or virtual site accessibility. That requires like a thorough understanding of what the participant, their journey is for accessing the trial components. This journey can start from their home, from transportation to drop off and pick up, to the site location, getting into the site, navigating into the site for different areas for appointments, and interacting with different forms of medical equipment, and the return back home. The perspective of this journey and its barriers, the barriers that someone will encounter will be different for people with different disabilities. It's important to plan for this journey with people with disabilities who have this lived experience, because they're going to be able to tell you the small things that they encounter daily. Please note with the following exercise conducted with all of us here in the workshop, who may not have lived experience with a disability. It's only meant to stimulate thinking. It's not intended to replace any comprehensive inclusion of people with disabilities within planning and conducting clinical trials. So our instructions for exercise number 2. So we're going to review everything together, similarly for the previous exercise, one at a time. The slides are going to show different situations that may be a part of a participant's journey at fixed sites, mobile sites, or through virtual applications. And on each slide, we'll ask you to consider where there may be challenges for people with disabilities and anyone who's accompanying them. And so enter your thoughts into the chat when prompted. You can consider the challenges from any disability perspective, such as visual, hearing, mobility, sensory, cognitive, and intellectual, or other disabilities. At the end of the mapping exercise, we're going to go ahead and do another summary of the lessons learned.
Sky, that was a perfect intro. So we're going to go through some pictures on the screen, and we're just going to write in the chat where you see that there might be challenges. And again, from any disability perspective, so visual, hearing, sensory, cognitive and intellectual, any disability. And it can be for the person with a disability or people accompanying them. So the first one is on fixed sites. So this is a picture of Mass General Brigham's main entrance. So I want people to look at this from, as I said, different perspectives, and you can put in the chat if there are things you see from, for example, if you have a visual disability or a sensory disability, which may be challenging to get from where, for example, the person who's at the far left corner in their parka to the front entrance of the building. And on the screen, just for those who may not be able to see it, we have, there's a building with two entrances. There's a street with an ambulance on it, and there's a crosswalk with people trying to cross it with a car that's going to be across the crosswalk. I'm just going to give one moment there. So some things that I'm seeing, and then I'm going to let Sky jump in, but I'm at MGH and this is a high traffic area. Yes, there are no stop signs or crosswalk assistance, no crosswalk lights, crowded sidewalks. I love that someone pointed out that there's an unclear entrance to use, which is hectic. The noise of the ambulance, again, crowded, noisy. Good, revolving door. No texture markers to show the end of the sidewalk at the crosswalk. So I'm going to go back to this picture on the screen, point out a few of these. So you can see here with this crosswalk here, there might be here in yellow a little bit, but it's very hard to see if there's a texture difference there, but there's definitely no crosswalk signal there that someone can push to stop the light. It's very crowded and there's multiple entrances, so that may be confusing which entrance to go in. And the doors are both revolving doors. So people have picked up on a lot of these issues. Other people in other webinars that I presented at have also talked about just, which I thought was interesting, the glass, that all of these buildings are glass, and on a sunny day, it may be very difficult to see because these are all so reflective. So I thought that was an interesting point. I'm going to go on to the next. I'm going to do two more slides and then Sky, I'll have you jump in to kind of summarize. So this next one, you guys may see this online. You may see this at a lot of facilities now. So at fixed sites, sometimes they have these check-in kiosks instead of, going to check in at, the appointment window with a live person. You have a check-in kiosk. And what we're showing on the screen is that there's a computer screen that has green background with white font that says welcome. And then there's a shelf that sticks out from the screen. Please list in the chat what you see here that may be problematic. Great. So I'm going to just put a couple of these up here. How can you approach the screen with an assistive device? There's no marker on the floor to signify where to stand for good reach. The kiosk may be hard to reach. Visually impaired people unable to read. Yes, somebody pulled out the color contrast of the background. It's white on green, very difficult to read. There's no braille for the sign. The language and literacy, correct. The shelf sticking out, if you were a person who uses a wheelchair, you would not be able to access the screen. nightmare for a person using a wheelchair. I love all of these. These are great. The space between each kiosk is small. So I'm going to go back to this picture. Thanks everybody so much for writing in. You've nailed pretty much many of the things here. As you reported, the color contrast is difficult there. Often the buttons are very small. So things like to hit enter is very small in the corner of the screen. If you're a person who uses a wheelchair or other assistive devices, you won't be able to reach the screen. I'd also like to point out just my own pet peeve that there's no one there to help you. Like if you have a problem, there's no one around. So, and I actually thought it was funny. I went to present on disability a few months ago and I went in to check in and this is exactly what was in the lobby. So I just thought it was an interesting case study. So let's go on to the next one. I think we're doing okay on time. So fixed site still, we're still in the fixed site, 2 more on the fixed site. So this is a waiting area in a fixed site. And what it shows is that the people are being asked to wait in a hallway, which is has many people in it. And there's also medical staff in there at the same time as patients. And it's a white hallway with bright lights. So I'd ask people to comment in the chat quickly on things that you may see here, again, from visual, mobility, sensory disabilities, any kind of disability that you may have, a hearing disability.
I'm seeing a lot of space concerns, noise, privacy. Someone said a migraine trigger with all the white and the noise. Probably difficult to navigate with a wheelchair.
Great, so too many to list. I love it. Okay, so yes, so there's, again, if you're a person who uses a wheelchair, it'd be very difficult to navigate in this hallway with all of the legs sticking out. It's very bright. So if you have a sensory disability, it's difficult with the bright lights. The signs are posted on the side of the door, but they're clear. Very difficult to see them, and they're not at a height that's easy for a person who uses a wheelchair. It's probably, you can see people on their phones. It's probably very noisy. There are people having conversations, the medical staff with the patients in the hallway. There's also numerous plants, which may be nice, but can also have fragrance sometimes. So there's a lot of challenges here. Again, people say too many to list, but there's many. We're going to go on to this one, which was a favorite of Skye's. So I'm going to show you, this is again at a fixed site, a diagnostic exam room. I'll let people throw into the chat some challenges that they may see here as well. Skye, I'm going to let you comment on these because you had some great comments as well.
Oh, thank you. Someone said scary, lots of mobility limitations, table obstruction, standing assistance, the low light with the noise can be a challenge. MRIs can be a challenge just because of the noise in general with using the machine.
I think you pointed out to me before, Skye, and people are commenting in the chat that the low light can be a challenge sometimes. The different colors in there, it looks like something from space, right? Like you're getting in some kind of space mobile, which can be very scary. So for people particularly who have sensory disabilities or intellectual disabilities, there may need to be some pre kind of discussion and sensitization to what they're going to encounter. Also, the table, it's not clear if it's adjustable here. So, again, another challenge. But I think people got to the main thing here for me, which is that this is incredibly intimidating, I think for a lot of people. So I'm going to go on to the next one. So we didn't want to just talk about fixed facilities. We also wanted to talk about mobile sites. So we have 3 more slides to go through. This one is taken from, I think, the beginning of COVID. And what's shown on the screen is a testing site, a theoretically drive-up testing site under a tent in a parking lot. And there are many kind of barriers in the parking lot to get to the tent. So we thought that we'd ask people from a visual perspective and from a physical disability perspective what they see on the screen as challenging.
We've seen a lot of concerns with privacy, which is absolutely there. It's very difficult to know where to go, lack of signage, no clear walkways.
Great. Yes. So
Yeah.
exactly. I love that people pointed out the signage. It's very confusing. There's so many different signs on here. And also the color contrast of some of the signs is not great. The white on the blue. There's a huge number of curbs in here. If you are not in a car, it's quite dangerous to be able to access this site. And something that we've also talked about before, if you have a service animal, if this is in the summer, this is very hot pavement. If it's in the winter, there's going to be snowbanks to navigate, potentially icy walkways. So these are all things to think about. And I think people are doing an amazing job in the chat commenting on this. I'm going to go on to the next slide and just describe this one myself before we go to the last one for the chat. So I wanted to comment on fixed sites. What we're seeing, or sorry, mobile sites, we're seeing a lot of, which is great, a lot of mobile vans and mobile containers that kind of go out into communities on trucks to kind of, do diagnostic testing like, blood pressure or diabetes testing. I couldn't find a picture of an inside of one of these vans. This is from an ophthalmology unit on a train. But I just wanted to point out that inside these, so you can see that the doorway is very narrow. You don't know if there's actually a ramp to be able to get inside. The equipment, the table, and that there's a table in the back to lie down on, but it's a fixed table. It's not adjustable. There's many kind of stools to sit on that you can be shifted around, but they also block the hallway. And again, we have very bright lighting and things like that in here. So just trying to think about consideration. We talked a little bit before about decentralized trials. What does that really mean when you're setting up decentralized options for your trial? Are they actually accessible for people with disabilities? And so this last one, I'm going to have people write in the chat. So another thing that's becoming very prominent are mobile applications. So on your phone or on your computer, on your watch, during trials where you report your data back through these mobile applications. So I'd like people to look at the screen. There's a person who looks like they just finished a run, who has a watch with some data on their watch and also a mobile phone that's got some charts and things on it. Could you please take a few seconds to write in the chat where you think people might have challenges here?
I'm seeing some speech to text concerns, which can be not available in some of these new off-the-shelf apps. They don't build that in a lot of times. The text is very small on the screen. There's too many graphs. a lot of color choices that we're talking about in the chat here as well.
Thanks, Sky. You're picking up, and people are picking up on a lot of great information here. That, first of all, you have two different devices. You need to be able to have mobility in both hands to be able to utilize these. I also want to point out that they're showing a person with running shoes, and the assumption is that the measurement outcome for this trial is going to be through some sort of walking or running, which may not be the most appropriate measurement outcome. There's other measures of fitness, but also the font on these screens can be very small. You can have data presented in different ways, which isn't clear why you have it in numeric and in chart format. The color contrast might not be good. So there's lots of different things. And also they can be very confusing. So, the instructions can be difficult to follow. And one of the things that people have pointed out when I've done this session before is that oftentimes the help desks are not accessible. So if you try and access a help desk, for example, you may not be able to access somebody who has, closed captioning or the instructions aren't available in a screen reader format. So for example, they just put up picture, like a screenshot of instructions. It's just a picture that you can't use a screen reader on the picture. So, there's lots of challenges here and lots of opportunities. There's so many ways to make these more accessible, and it makes it accessible for everyone, whether you're a person with a disability or not. So I'm going to go, I will summarize these. I think there were great points in the chat to summarize, but lots of the points that people made in the past are just really, I think, what I want to summarize here, and we'll send the slides afterwards and I'll fill them out, but are things like really thinking across different kinds of disability, really doing the in-depth work with people with disabilities to kind of map these out, and that it's not just fixed sites that we need to think about, but also mobile sites and mobile technology. So those are just kind of a few summary pieces. So I just wanted to say thank you, and then we're going to go on to the Q&A. So I'm going to stop sharing and go into the Q&A, which I haven't seen yet. So we're just going to go in and start addressing these questions. So let's see if we can pick up a few. Let's see. So one here is, how does alt text handle gender? For example, the person may appear to be a woman, but may not identify as such. Let's see. Sky, do you have any comment on that, or would you like me to try and take that one?
I'll go ahead and let you take this one first. I have maybe potential thoughts on this.
Okay, so alt text, sometimes what happens is you'll have default alt text that comes up like when you have you import a picture from something. I tend to, for gender, so we also have, I actually work with an LGBTQIA+ working group. And so the intent is to make your images gender neutral. You can say, use they repeatedly, or a person. You can use a family, like there's different ways to make your text gender neutral. So instead of saying she or he, or the male or female, you can say the participant, or the researcher. If the intent is, again, if we're talking about something that is gendered, if the research is gendered specifically, or you're trying to point out something like, women in research or something like that, when we're talking about workforce diversity, then you may want to be pointing out specific genders. But for the most part, we do try, and just to say, in our imagery, just in general, it's helpful to have imagery that includes people of all different kinds of gender identities, so that it's responsive to, showing everybody, and people with disabilities as well in your imagery. So let's just see what else is in the Q&A, if that's helpful.
It is very context dependent. It depends on the message you're trying to get across.
I'm curious about your recommendations for using verb tense of alt text, present tense, past tense, using ing verbs. I don't know, Sky, in your experience, what do you think is the best way to handle that? Like when you're reading alt text?
Uh, Let's see. I think for me, the thing that I like the most about when I'm using alt text is that it can create a little bit of like a mental story. So as long as I can get the kernel of what you're trying to tell me, the past present using INGs doesn't trip me up because I'm not focused on that piece of information. I'm focused on the message that's trying to be conveyed to me.
Good to know. Okay, let's see. I'll also say that we're going to be taking these questions and both Sky and I will be discussing them afterwards and we'll be listing them, on the link that we post to all the slides. So we'll take these and we'll answer them all. Let's just see. Is there a particular question that you'd like to take in the Q&A, Sky?
Um, let's see. Oh, will screen readers skip images which are marked as decorative, or does it say decorative image or something else? It depends on the screen reading software that they're using. iOS has a lot of great accessibility features. Some of the free software has this great accessibility features. JAWS, usually it'll just skip right over it because the screen reading technology doesn't want to clog up the system, is usually what happens most often.
I see one here that says, what do you advise to avoid regarding description of people? Was it assumption of emotional state? Would smiling person be better than happy person? Yes, I think your example is a very good one, smiling person versus happy person, or, again, you don't want to say something like assume disgruntled person or upset person or um, uh, trying to understand kind of what they're thinking at that time, or anything that's derogatory is not something that you want to be saying. So saying somebody, you can describe someone's physical characteristics, but you don't want to be calling them something that you wouldn't want to be called yourself. So okay, I'm going to try, let's see, there's one more. Oh, and just to say, we describe this in the Accessibility by Design Toolkit, but when you're working with people with disabilities, there's different kinds of language that people prefer. So there's person first language, which is basically describing the person first. So, for example, a person who uses a wheelchair. But there's also some people prefer disability first language. So, for example, an autistic person. And it can really vary by the person and by the community. So it's important, to discuss with the community what who you're working with, what kind of language you want to be using. And sometimes what we do is we mix both. We'll use both throughout the alt text. We'll kind of alternate depending on, what the feedback is we get from the communities.
Yeah, you can always ask the person that you're interacting with what they prefer or what help or assistance they need because they're used to it. That's part of their daily life.
Okay, so it's almost time to go. I think what I just wanted to say is to say thank you so much for attending. I think all of your feedback has been incredibly helpful in the chat. We will post the link to everybody who registered to the slides and the video, to all of the questions that we're going to answer, and to all of the links that were shown in the slides. So thank you so much for attending, and I hope everybody has a wonderful day.